Thank you for joining us. Today's health briefing is the third in a series of bi-weekly briefings focused on presenting real-time COVID-19 healthcare data specific to vulnerable and at-risk populations in South Central Pennsylvania communities, inclusive of York, Lebanon, Lancaster, Hanover, and Gettysburg. This briefing is presented by Family First Health, a leading regional healthcare organization serving at-risk populations for the past 50 years. Family First Health is a federally qualified healthcare center serving more than 20,000 patients annually. We invite the media and the public to submit questions in the comments section of this video post or in advance of our briefings by emailing healthbriefings@familyfirsthealth.org. Copies of the video briefing will be made available online at familyfirsthealth.org shortly after each briefing. We will begin momentarily.
Good morning, everyone. Thank you for joining us today. As a community healthcare provider, Family First Health is dedicated to providing quality, accessible care to the vulnerable, at-risk, and underserved populations of our region. Today, we will discuss the ongoing impact of COVID-19 on vulnerable population and the need to continue to stay vigilant to mitigate its spread. While we serve the South Central Pennsylvania region, we are not unlike many other challenged communities nationwide that face the virus and are having disproportionate effect on the vulnerable at-risk minority communities. Our goal is to inform you of real-time data that we compile reports on care to the patients in our local community so that we may work collaboratively to achieve improved healthcare delivery and wellness. By elevating, understanding, and giving a voice to those most affected by COVID-19, we hope to create an opportunity to bring necessary attention to the challenges we have long known, how the social determinants of health are weighing heavily on our patients' ability to be healthy. Add to that the challenges of vulnerable population that is more likely to be employed by an essential service employer, which are often high contact industries, and these individuals are at a higher risk of exposure and potentially lost income due to the exposure. Today, after reviewing our most recent data regarding COVID-19 and our patients, we will take a deeper dive into the most recent learnings about the virus, including who is disproportionately affected and the need to remain attentive to mitigation efforts against the spread of the virus. For today's health briefing, I'm joined by Dr. Luis Garcia, a family physician here at Family First Health. So let's talk about what agenda we will cover today. Our agenda that we're going to cover today will be updated comprehensive data regarding how COVID-19 has impacted our region, most vulnerable population, from information collected on our patients at Family First Health. We will be discussing how to mitigate the spread of COVID-19 and avoid an outbreak in our region. And we will also be hearing about patient stories from Dr. Garcia. As a reminder, please submit your questions in the comment section of our producer. We will ask our producer to ask those questions live during our Q&A. And now we will start with going over some data that you might have seen before previously presented, but we will be giving you an update that has happened in the last 2 weeks. So on this first slide here, this is showing you a breakdown of the vulnerable at-risk patient population that Family First Health serves in South Central Pennsylvania. The first graphic representation is about insurance status. So majority of our patients are Medicaid, Medicare, and uninsured, and about 18% of our patients have commercial insurance. The middle representation is by race and ethnicity, for which we have reported data on. We serve about 19% of our population is Hispanic or Latino, and 14% is Black or African American. So minority of our populations compared to the majority, which is 54% Caucasian. And then the third representation is by income status. So 48% of our patients are below the federal poverty level. Here we're using the measure of 100% poverty level for a family of 4. And we can see that about 17% are at federal poverty level between 101 to 150%. So most families are living in the poverty level. So we're going to go to the next slide. So this slide is showing us a cumulative running total. So here, we've highlighted for you that we serve over 25,000 patients. During this pandemic so far, we have tested 983 patients of Family First Health, and we have had about 186 positive tests. So if you look at for those who have tested positive, for patients who identify their primary language as Spanish, that accounts for 67% of the individuals who tested positive, and 33% who identify English as their primary language. In the middle representation, it's by ethnicity. So of those who have tested positive, so we're talking about 186 patients, their ethnicity, if they identify as Hispanic or Latino, accounts for 78% of those who tested positive. and about 19% are non-Hispanic Latino individuals. And then the last representation is something that we touched before, but of those who tested positive, 87% of individuals are living below the federal poverty level. So this is just a comparison to help you understand where Family First Health stands to our broader community than to our state. So of the individuals tested and positive, our positivity rate is 18.9% at Family First Health. But in the York County, for the total number of tests done and the individuals who are positive, the positivity rate is 6.4%. So our community and our patients that we serve at Family First Health are disproportionately affected. In state of Pennsylvania, the positivity rate is 10.7%. So higher than York County, because there are communities that were hit harder. However, our rates are much higher compared to the state level. So one of the key findings from our data that we learned early on is that your ethnicity and your race did have a disproportionate effect on your likelihood of having a positive test. So you are 4.5 times more likely to have a positive test if your race is Hispanic or Latino. And each week that we accumulate data and we add to, we are tracking if there is a difference. So we have seen in the past 2 weeks that there is 0.41 decline in the number identified or your likelihood ratio of being positive. And if you speak Spanish, the likelihood or your chances of being positive are 4.3 times more likely. And we have seen a decline in the last 2 weeks to 0.11. I would like to add here that our landscape and our environment of why we're testing is changing as we are seeing a rise, but also some mandatory testing for travel or other reasons by employers. We are testing individuals who are not symptomatic. So we're going to see a slight change in the data. All right. So we're going to talk about some deeper learnings and dive into what we've recently learned about the virus and how people are disproportionately affected. So I would like to invite Dr. Garcia, who is a friend, and I would like to welcome him to our conversation. He, as I mentioned earlier, a practicing family physician who is serving our George Street site. So Dr. Garcia, welcome.
Hi, thank you. Glad to be here. So basically what I wanted to do was discuss a little bit more about the kind of the social determinants that are affecting specifically the Latino population. So here at our George Street location in York, that's primarily the population that I see because I can speak Spanish. And I want to just be clear that there's nothing intrinsic about being Latino that makes someone more susceptible to getting the virus. It's not like something that's genetic or heritage or anything like that. But we have to kind of look broader at some of the other social factors that are affecting them. And I think in our in the previous slides, one of the key findings is the correlation, the connection between poverty and the virus. And so when we see people that are living in situations of poverty, we're seeing that they're having a higher likelihood of contracting the virus. And especially in the Latino community here. So we see it across all different minority groups. We've seen it across the nation. When you look at Native Americans, those have been most affected, followed by Latinos, and then in the Black community as well. So there's lots of reasons why, but in thinking of on the Latino side, I think we have to recognize that many of these people are working in what I like to think of as sort of the invisible workforce of our nation, sort of the unseen people that are working. They're working behind the scenes, right? These are the people that when you go to the grocery store, a lot of the food that you see that's on the shelves, the meat, the vegetables, much of that food has been prepared in factories and facilities by the Latino workforce. And many of these places are, like you said, Dr. Patel, high contact areas where people are working in very close proximity to each other. And there's a lot of pressure, a lot of demand for them to kind of get the products out as quick as possible. So we've seen especially a lot of outbreaks around the country in these sort of high contact facilities, meat processing facilities. And because we have a lot of Latinos working there, they're the ones that are being highly affected. Then you compound that with housing, right? So many of these families are living in multi-generational family homes. And I have this in my patients where I've got, 4 generations of a family living in one, narrow row home that maybe has 2 or 3 bedrooms, but you've got 10 or 12 people living in there, grandma, great grandma, all the way down to, the grandchildren. And I've seen this in my patients where I've had, my youngest patient that got COVID was a 5-month-old. My oldest patient so far is an 88-year-old. Thankfully, everybody has survived. None of my patients have suffered demise from COVID-19. So that's really great, including that 88-year-old patient. I was very proud of him for pushing through. So you have this this family structure, this sort of home structure where maybe you have only one bathroom, maybe you only have a couple of bedrooms. You're not able to do that physical distancing that everyone else is recommending. The other part is, thinking back to the type of work that these people are doing. Like, these are the essential workers that have that we've been talking about. I mean, we get a lot of credit, as healthcare workers, but I really think we need to give more credit to these essential workers that are keeping food in our grocery stores and keeping food on our plates, because they're the ones that I think are suffering the most and putting themselves at risk the most. We here in my office, we have the great ability to protect ourselves, to wear masks, to wear face shields, to wear gowns and all those sort of things. But people that are working in these other types of environments, they don't have that luxury. Their employers, unfortunately, haven't been able to provide them those things, at least early on in the pandemic. Now things have changed a lot. And so, my patients that work in some of these facilities feel a little bit safer working in those places now. But early on, they were very scared. I mean, they were very scared to go into work. They were very scared that, they were going to be the next person to get the virus, because they were seeing their coworkers all getting sick. The other part that I think, did you want to say something, Dr. Patel?
Well, I was going to say, Dr. Garcia, you're talking about patients whose primary language might not be English. So I was going to ask about your experience with your patients about, did we do a good job giving them the information that they needed to protect themselves? I know that they're working in a very high risk setting, but did we give them the information that we had available earlier on in a way that they can understand in their primary language to be able to help these communities?
Yeah, unfortunately, I think the answer is no. We adopted telehealth pretty early on. And one of the things that I noticed that happened a couple of times where I was, doing a video visit with the patient, and we're talking about, being safe and not being around other people, and they're like, oh yeah, like we're not going now, we're not doing anything. And then I would see someone that wasn't part of their family come in the background of the house and, oh hey, just kind of like nothing, and no one's wearing masks and anything. And so I had to, kind of take some time to like educate, like, no, look, this is serious. You need to, just because someone is your friend or your neighbor, this is how the virus spreads, by coming in close contact with people. And so I think the messaging was missed, in particular because there was a predominance of the messaging being in English. And then the sources of media that are being used to promote the message aren't necessarily the ones that my patients are using. So, so definitely, I think the messaging was late to our patient population, late to the Latino community. But the other thing I wanted to point out was that, think of, put yourself in the shoes of one of these people that's working in one of these facilities, right? Let's say they did get the message, right? They did know that they should be wearing masks. They did know that they should be socially distancing. And yet they go into work and they're, crammed up against two other people who on a line, and what can they do? And they don't speak English. So how are they going to speak up to the management, speak up to their supervisors and say, hey, I don't feel comfortable doing this. I want to have some sort of, protection here. So their voice was really muted early on. So, I laud some of the news and media that kind of highlighted some of the injustice that I think was going on early on for some of these patients. So I definitely think that the language barrier plays a significant role in how our Latino population in particular has been affected by the virus.
Dr. Garcia, I know that the organization has been keeping data for patients with COVID-19, but I know that you have been very enthusiastic and an advocate for your patients, and you're keeping your own data. So do you want to share some of your personal findings with the data that you have kept?
Sure. So if we look at York County and the statistics from York County, the number of cases that we have per the population in our county comes out to about 0.3%. So pretty low, pretty significantly low, I would say. But when I look at my patient population, so what we call my patient panel, so these are the patients that are assigned to me, that I'm their primary care doctor. When I look at that number of patients is about 3%. So 3% of my patients have contracted COVID, compared to 0.3 of the general population in our county. So it's an order of magnitude higher, right? And so to me that that's not surprising, because that just kind of goes along with everything that we've been saying already, that the Latino population is more affected. Give me 1 second. Okay. So that's been one of the things that we've found. The other thing to note is that, going back to the idea of being in close proximity to other people, and we know that in cities, we've got a lot of crowding and people living close together. And in York City in particular, over 70% of the cases that have been reported in the city have been in the Latino population. However, they only make up about 30% of the population in the city. So there's been a huge disproportionate number. And I think, you wonder, like, okay, well, why is that? I think that goes back to the nature of the kind of work that they're doing, of working in these type of close contact facilities.
Dr. Garcia, I feel like they were constantly learning new things during the pandemic. What has your experience been in terms of certain demographics or populations or risk factors that you have been counseling your patients on? And have that changed over the last 3 months of who you consider high risk and the current trends that we're seeing?
Right. So, the people that we're constantly learning, because it is changing. But the people that we are now seeing as being the most high risk are people who suffer from obesity, and then, diabetes, hypertension, respiratory issues, of course. These are going to be your people that are most vulnerable. Of course, the people that are older as well. But, age, as I've noticed, it is a factor. But I've had, one of my patients who is in her 50s was in the hospital for 31 days. And so, she had some of those other comorbidities, but, she wasn't, she's not like a 300-pound person that's going around that's you would think would make her really susceptible for her risk factor. So in some sense, we can pay attention to the health risk, like the underlying conditions that can make someone at risk. But on the other hand, we really don't know. Like I said, I had a 5-month-old, a 7-month-old. These children had no risk factors, and they still got sick. Thankfully, their symptoms were very mild. They didn't have to be hospitalized or anything. But even young adults who are generally healthy, a lot of some of my patients kind of fall into that category. Being between the age of 20 and 40, and they've gotten sick. Some to the point where they've had to go to the emergency room, to get IV fluids, to get treatments. Not to the point of needing to be hospitalized, but certainly it has pulled them out of the workforce, pulled them out of their responsibilities for at least a couple of weeks in many cases.
Yeah, I absolutely agree with everything you said. And I was surprised that earlier on, we didn't have much data on how pregnant women could be affected by COVID. But now the CDC is collecting more data, and we are aware that they're at a higher risk. So that's another set of population that we serve that we're seeing that can be impacted, and we're trying to increase awareness. So I guess I would like for us to first talk about some points on mitigation, and then we'll continue our conversation and your experience with your patient that has been very valuable. So one of the things that I have noted is that we as a community have celebrated that we're gone into the green phase. But I would like for us to remind us that nationally, what we're seeing, and even in the state of Pennsylvania, that the cases are going higher. So the pandemic is still very much present, and you can still be very much at risk. As Dr. Garcia was mentioning, that we are seeing young, healthy folks, get the virus, and we're seeing young folks with just one risk factor, like obesity. When they get the virus, they can get very sick and need a hospitalization. So we want to remind our young folks who are working, who are out there, who are trying to enjoy the summer, that social distancing is very, very important when it comes to mitigation. And as we talk about mitigation efforts, we want to hear about the vaccine. We want to hear about that evidence-based medication that's going to help us with the treatment. But right now we have trials going on, but we don't have results. We don't know what evidence-based treatment is going to work, but we do know what evidence-based mitigation factors are working, that we need to continue to employ them and push them in our communities. So I would like to first emphasize on social distancing. CDC has this very nice article that they released early that they're going to be publishing on their emerging infectious disease volume next month. But they released it a month early because they want to bring to everyone's attention that social distancing works. They talked about that, there were many states that were early adopters of social distancing, and they had orders out and lockdowns earlier. And if you did that, you actually delayed the curve completely of number of cases of patients who would get the coronavirus. But if you were a late adopter, right, the community got hit, and then you put in the intervention for a lockdown, then what we saw was that order that was affected allowed for the curve to flatten. So we flattened the curve. But there's definitely data that social distancing works. Just because we're in a green phase does not mean that we do not have to practice this. We are in a pandemic, and we need to continue to socially distance. The second evidence-based intervention that is really working, that didn't get a whole lot of attention very early on, is masking. So masking is very, very important. It shows that you can prevent infections if you wear a mask and the person who you're within 6 feet is wearing a mask. So I am not wearing a mask so I can protect from getting an infection. I am wearing a mask to protect you so you don't get an infection from me. And what I need is that everyone in my community to wear a mask to protect me. So the data on the masking, there is an article that was published on June 16 in Health Affairs that showed that the 15 states who actually had an order that masks are mandatory, and then they included District of Columbia, they showed that between April 8th and May 15th, that we have averted 230,000 to 450,000 cases of COVID-19 by having a masking order that made it mandated. Now, as all of you are aware, in the state of Pennsylvania, Governor Wolf does have an active order when we are in public places. indoors. And if we cannot maintain a 6 feet distance, no matter where we are to wear a mask. And then I just want to emphasize just good public health in terms of hand washing is very important throughout the day to decrease your risk. So just wanted to talk about this mitigation factors and emphasize that we have data for it and we need to continue to work on it. Dr. Garcia, was there anything that you wanted to add in terms of mitigation efforts or messaging for our patients?
No, I think that's all very clear, and I think it's unfortunate that the impression that I think some people have gotten with the color scheme, the red, yellow, green, is that, once we've reached the green phase, we can kind of, go back to normal, because that's sort of what that color tends to imply. Green means go. And I think that while the marketing behind that was well intended, I think it's hard for people to sort of grasp, like, wait a minute, you're saying that we're green, but I still have to wear a mask and I still have to do this social distancing thing. How's that different from before? I don't really get it. And so I think we do need to continue to reiterate that message, that we do want to be wearing masks when we're in close contact with other people and out in public, so that we can continue to prevent the spread. Because what I'm seeing is that a lot of people are falling into that mindset of just getting tired, right? Like we're all kind of tired. We've been through this for several months, and we just want things to go back to normal. And I get it, right? It's been tough, but wearing a mask is essentially an act of charity. It's an act of love for our neighbor, and when we're not doing that, it's almost the opposite. So we have to kind of consider, in ourselves, like how much do we want to be caring for each other as a society, and here locally, we want to be looking out for each other, because it's a sign of humility for us to say, like, I don't know if I could be an asymptomatic carrier. I don't know if that could be me, and therefore I'm going to be protecting you by wearing a mask. The other thing about the mask is that, and not to get too into the weeds with the whole mask issue, but there's a lot of commentary and memes and all these things about kind of the virus particles going through the fibers and all these different things, but that's not really what the research shows, and so I think we need to also just kind of focus our attention on what our medical professionals are saying and what our researchers are saying and what the experts are saying, and not necessarily what we see from our social media feed.
Thank you, Dr. Garcia, for that important message. Now we would like to take some questions that have come through, and I will read the question here. So our first question is, what could be contributing to higher positivity rates among younger patients?
Well, I think it goes back to kind of what we just talked about. It is just sort of, as humans, we're social creatures, right? We want to be with each other. We want to be around each other. And, especially when you're living, in your young adult years, your youth, you also have a tendency to think of yourself as immune or invincible. And unfortunately, that has led to a huge rise in cases among that population. And I've seen that. I've had several patients of mine, some of who work in healthcare, that have gotten sick, and part of that is just because of ignoring some of the distancing rules that are in place. The other thought that I think people have is, well, if I get it, I don't have obesity, I don't have diabetes, so that means that if I get it, I'm not going to get very sick. But I've actually seen people that are, young and healthy, they get very sick. They've had, the respiratory issues, the GI issues, everything, and, losing their sense of taste and smell for weeks. So it's not a benign virus. It can definitely still make you very sick. So I think it has a lot to do with some of those social factors.
No, I agree. And then I would just add that we have a much higher rate of also asymptomatic patients who do not know. And when you're young and you feel invincible, but you're out, living your life, you could be spreading it and you could not be sick. So we've seen both ends. We've seen young folks who are healthy, who are asymptomatic, and we've seen young folks who get it and who are very sick and need to be in the hospital. Okay, so our second question here is, we're hearing a lot about vaccines. Have you heard any projected timeline for a vaccine and how they might get rolled out? So I will take a stab at this question. So yes, we are very much looking into vaccine nationally and globally. There are many countries and companies trying to put out vaccines. We have funding for it right now, and public-private partnerships who have taken an interest as this pandemic has affected the entire global community. There are more than 5 trials that I specifically know about nationally and globally that are in phase 2. In July, about to go into phase 3, and they're going very well. What does that mean? So phase 3 is really important. When we proved safety and efficacy, that's when we really give it to a larger population. So phase 3 trials are, if tens of thousands of people. So they would be trialing the vaccine on 10,000 people. And now the difficult part with this vaccine for coronavirus is that we have to test it in people who are at risk for getting it. So we need to predict which communities will be becoming a hotspot and make the vaccine available in that community. So we're not chasing it. So it's going to be very difficult at times, but the studies that are doing this, they have centers in all over, outside of United States and in United States. So we're hoping that they're going to be able to get good data. But I do not think that any vaccine trial is looking at it so that we will have a vaccine available anytime soon, right? We might be lucky if we get it at end of 2020, but we need to continue to look at what is working, utilize that until we have vaccines available. So thank you for those 2 questions. Due to time, we will not be taking any more questions, but I do want to give Dr. Garcia an opportunity to at least share one patient story with our audience. I think that speaks 1,000 words.
Well, I mean, I touched on a few of them already, but I think one of my favorite patients was my 88-year-old guy who got sick. I asked them kind of like, where do you think this came from? And this was one of those cases where they didn't know. And so later on, after he was out of the hospital and back at home, this was one of those situations where in the background, I see people walking around that aren't necessarily part of their household. And so it had to be sort of a re-education of like, look, you can't let people into your home that just because they're your close friends. But he did really well. He was just in the hospital for 3 days. He needed some oxygen coming out of it for about a month, but he's kicking along and doing great. So I think one of the trends that we're seeing is less deaths in the population. And I think that has to do with sort of a better understanding of how we can handle the virus in the hospital setting in a more effective way, as some of the research and data comes out of that of treatments there.
Absolutely. So I just want to summate what Dr. Garcia has shared about the data that we presented and things we have learned. So it is unfortunate that certain minority groups are affected disproportionately, as we have seen locally that the Latino and the Hispanic community in South Central Pennsylvania is affected. I want to emphasize that the mitigation factors that we talked about on prevention of COVID-19 are very important. Social distancing, masking, hand washing, is very important. From the points that Dr. Garcia shared about where are his patients residing, where are they working, it matters. So, that saying that we see everywhere, where we live, learn, and play affects our health. And we have seen it in this scenario where our Latino and Hispanic community who is living in high density housing area are affected disproportionately, and their social determinants of health are affecting their health outcomes. So Dr. Garcia, do you have any parting thoughts that you want to share?
Well, I did want to share about the vaccine thing. You know, this is something that I think as a society we want it now, right? And we want it right away. But vaccines are one of those things that you don't want to rush. You want to make sure that they are going to work and be effective. Because if you come out with a vaccine rushed and then you have, you know, adverse side effects or it doesn't work the way that it's expected, then you actually end up creating a negative image of the vaccine in the public, and then nobody wants to get the vaccine. So when we do this, when it does get rolled out, we want to make sure that it's done correctly. So we just kind of have to be patient, make sure that that what comes out is going to be effective.
Yeah, no, I agree. So I would like to add to what Dr. Garcia said. The vaccine production, it's a very complicated process and it takes 6 to 9 months. So for example, the flu vaccine that we're going to be getting this fall, they start making that 9 months ago. So when we have research going on and we find a vaccine that works, it takes that long to make it. So we've had a collaboration and agreement of some high-stake companies that are willing to produce the vaccine in partnership into large doses, but we necessarily want to know at a much larger population level how effective they are, but they will be available. So I think that this is new. We're first time gonna have a vaccine against coronavirus. And in this pandemic, we wanna take anything that will help us, but it's gonna take a really long time and everyone is doing what they can to expedite the process, but we wanna make sure that we go through the steps to make it that they're safe and effective. And when it is available, I think that it somehow is going to have to start with individuals who are very high risk. So there was a second part of the question that, you know, due to time, I had not asked as to, you know, who should get the vaccine first. And we don't know yet. There's not a vaccine in the market. But I would assume that our high risk individuals are going to get it first. And because we need a sustainable healthcare workforce to continue to serve our patients who are sick and our patients' primary and chronic care needs, that I think that healthcare workers will be prioritized in getting the vaccine along with other high-risk populations. As we close, I want to thank everyone. I want to thank you, Dr. Garcia, for taking your valuable time. I know that you would normally be taking care of our patients at this time. And I want to thank everyone who joined us in this health briefing. We will be posting this briefing and copies of the data that was provided to our website at familyfirsthealth.org immediately after this briefing. We will have our next health briefing on Thursday, July 23rd at 9 a.m. Please follow our social media channels for the latest update. Thank you.